At least 25 people are hospitalized after overdosing in what city officials call a mass casualty event in the Penn North neighborhood in West Baltimore. At least 5 people are in critical condition.
Tonight, we are hearing from residents who say that drug use has gone unchecked in this neighborhood and across the city for far too long.
It's saddening, but the thing is, you know what? It happens every day. We're just seeing it because everyone's out here.
Thank you for joining us tonight. I'm Maxine Stryker.
And I'm Kai Jackson. Let's go right to Fox 45's Keith Daniels, who's live outside of the University of Maryland Medical Center with more. Keith, what can you tell us?
Well, Kai, we've confirmed that some of those overdose victims were brought here to the hospital. Their conditions unknown at this hour, and some of them may have already been released as police tonight investigate exactly what happened. As it all unfolded near the corner of Pennsylvania Avenue and North Avenue, those fed up with the drug use and those who admit using drugs say there's no shock that it happened.
It's not surprising to me, and it hurts me because it could be me. It could have been me. You know, 15 minutes early, it could have been me. But it's saddening, but the thing is, you know what? It happens every day. We're just seeing it because everyone's out here.
More than a dozen medic units, numerous EMS officers, and members of the Baltimore Police Department flooded the Penn North area in West Baltimore early Thursday. A huge response after the report of a single overdose led to the discovery of at least 14 more people showing signs of a drug overdose. Investigators say 5 of them critical and clinging to life, casualties of a drug they took.
Don't know what the drug of choice was, and I can't confirm anything at this point. You know, obviously we would need analysis, right? But right now we just don't have that information.
What happened at Penn North, a grim reminder of a recent dubious designation bestowed on Baltimore. In a report from the New York Times in May last year, Baltimore was dubbed the, quote, U.S. overdose capital, with nearly 6,000 deaths over the last 6 years. The Times analysis showed from 2018 to 2022, the death rate was nearly double that of any other large city. Those at Penn North Thursday,
this is a war zone,
calling it an open drug market where sales go unnoticed and drug use unchecked, ignored, they say, by city leaders.
These people sit here, police sit here 24/7 every day and don't do just watch them. And all these got blacks, whites, Chinese, everybody. They don't care.
Police say they're now launching a criminal investigation into this mass overdose, searching for clues and suspects.
We're treating the scene as an active crime scene. We're utilizing our investigators as well as every crime camera we may have in the area. We're speaking with not only multiple witnesses, but also some of the victims at this time.
It's very sad. I'm telling you, it's sad. I don't know what we're going to do about this.
Where city health officials and the mayor's office of overdose response responded. They also responded to this event. They distributed Narcan and test strips to people in the area. They also gave them a warning, telling them they simply don't know what's in the drug supply in that area. We're live tonight. Keith Daniels, Fox 45 News.
Keith, thank you. Baltimore City State's Attorney Ivan Bates says prosecutors from his office are in contact with Baltimore Police to assist the investigation in any way they can. Governor Wes Moore says the state is coordinating with first responders in West Baltimore. He says he's grateful to people providing community support.
And according to our partners at the Baltimore Sun, the Penn North neighborhood where today's incident occurred recorded the most overdoses in the city between 2022 and 2024. Open Baltimore data shows that zip code had over 1,100 overdoses, about 15% of the city's total overdose reports.
Fox 45 News has been reporting on drug addiction and overdoses in Penn North for years. In 2022, we spoke with several residents who say a nearby open-air drug market led to drug-related issues and violent crime.
Constantly are on guard. You constantly hear shots, and all of this is due to the large open air that we have here in this neighborhood. Should not have to live this way just because of my zip code.
We have also heard concerns about open-air drug markets near the Upton Metro Station, just a few blocks south on Pennsylvania Avenue. At that intersection in 2023, 2 teens were arrested for a mass shooting that left 2 people dead. And then Councilman Eric Costello said that corner had been a problem area for years, and residents had been calling for help from the city.
It's one of the largest open-air drug markets in the state of Maryland, if not the largest, at Pennsylvania Avenue and Lawrence Street. It's something that the community has been very vocal about over the years.
Our community needs help, and we need it bad, because otherwise all our young kids is going to be on this ground.
Then this past March, 4 people were hurt in a mass shooting along Venable Avenue in North Baltimore. Councilwoman Odette Ramos says the shooting happened near an open-air drug market with previous issues of violence.
As Keith mentioned, last year the New York Times named Baltimore the overdose capital of America. The report found between 2018 and 2022, Baltimore experienced an overdose death rate nearly double any other American city. Over the past year, Baltimore sued and was awarded more than $400 million from prescription drug companies over their role in the opioid crisis. This week, the mayor's office presented an initial plan for how it wants to use that money for overdose prevention. Some residents applaud the city's efforts to implement addiction resources, while others argue the plan encourages drug use.
We need more spaces where people can come in and get services immediately, like right away. We can't put people on pause because addiction is not on pause.
Number 1, the infestation of drug addicts it's drastically increasing. It's like an infestation. Number 2, the attempts to help them seem to be enabling them, just masking the problem versus actually providing the help they so desperately need.